I am Dr. Buvaneswari from GBR Clinic Fertility Centre, Mogapet, Chennai. Today we are going to talk about IUI. There are a few things we are going to discuss here, and whom to do and when to do, how many times to do, and what are the complications of this procedure. So initially, what is IUI? Intrauterine insemination. And when we are preparing the semen sample and taking it through the cervix and putting inside the uterus close to the tubular osteum, it is called intrauterine insemination. There is another procedure called intracervical insemination. That is when we are putting into the vagina or only into the cervix, then it is called intracervical insemination. And sometimes it can be even the vaginal insemination can be done. That is for the people who can't consummate and some have a sexual difficulty, it is done. But generally in fertility centers, intrauterine procedure is commonly done. So intrauterine insemination, whom all we can do? Initially for the patients who have a male infertility, and when the husband count is very less than 10 million, and patients who have difficulty in conceiving after long period of time, that is at least 3 years to 5 years, and when it is called unexplained infertility, or sometimes when the woman has endometriosis operated, then we go for IUI as a basic procedure. And some people, if it is long period of infertility without a reason, the treatment starts with intrauterine insemination. So these are the indications for intrauterine insemination. And what is the basic requisites for the intrauterine insemination? Basic requisites are like one tube at least should be healthy, and age should be less than 35 years, and if you are having any previous surgery or anything, the tube should be healthy and free, and ovarian reserve should be good, and preparation should be healthy, and at the end of the preparation we should have at least 5 million. That is the cutoff we have. If all these things are met with, and then we can go ahead with intrauterine insemination. And what are the complications? 3 things can be there. One is a collection problem. When you ask for men to collect on demand, the difficulty will be there. Sometimes they cannot collect. For that, we usually, if they have any problem like that, we ask them to freeze the semen before IUI. So that can be done like that. And next thing is, the sperm previous semen analysis may be normal, and on the day of IUI the sperm count may be very less. So we should be prepared for that. If 2 or 3 samples done in the same center, then this problem may not come. In GBR Fertility Centre, we generally do at least 2 analysis to make sure that his sperm counts are alright. It's not only count, the motility and also morphology is very important. Once morphology is okay, and then even if it is less, sometimes we can go ahead, or we can ask the husband to collect one more sample so that we can process 2 samples and make sure we get at least decent amount of sperm numbers. So that way we can do it. And third one is cervical stenosis. Sometimes when we are doing the procedure only, we will come to know. Previously they would have said, okay, we have gone through procedure, no problem. But when we are doing many times in GBR Fertility Centre, I have seen people who would have had IUI and come, but ultimately they will have a cervical stenosis and very difficult stenotic cause. So we have dilated and done under ultrasound guidance, those people immediately they have conceived. So that is that if you by properly assessing the passage and bypassing the cervical stenosis and putting the sperm, they will have more success. Most of the times this is the only problem they must be having. So once we dilate and put the sperm beyond the cervix and go into the tube, then the success immediately it happens. So these are the main things we have to check before doing IUI. And after IUI, how much time to take rest? At least 15 minutes is important, because we have done over the period of our experience, and 10 years we are doing this IUI procedure, 10 to 15 years. So during that time we have seen that people who can immediately go that comparing to them, and people who are lying down for 15 minutes, it makes lot of difference. At least for the patients who have a different shape of the uterus or a position of the uterus, at least that 15 minutes, within that time that sperm reaches the oocyte, settle down everything, there won't be any backflow, and also patients also stressful, so they'll at least relax for some time. Progesterone injections can be given during that time. All those things can be done. So after 15 minutes they can do their normal activities. They can walk, they can go to the office, they can do their household work. And 15 days we need to give a luteal phase support with the progesterone hormones, and depending on their requirement, previous history, the luteal support will be decided. So these are the things. And also this procedure is a minor procedure, and it can be done without an anesthesia. It should be done in a sterile condition, and patient should have proper positioning and proper lighting, and she should be explained everything. She should understand the procedure, then she will definitely cooperate with the procedure. If they have any difficulty, we can do under ultrasound guidance. If they don't have any other difficulty, and we have already done hysteroscopy and laparoscopy, during that time we would have assessed a cervical length and internal os assessment. If there is no difficulty or obstruction, then we can do without an ultrasound. And process again, the sperm process, again that lab side we have to take care of it. And the lab process, two methods are there. Sperm, initially we can use wash method or gradient method. Usually gradient method gives lot of success, so and sperm recovery also will be good in that procedure. So we generally go for gradient procedure, and the media we are using, the catheter what we use also makes lot of difference. If we use a local catheters where the sperm toxicity test is not done, then sperm can die within the catheter itself. So we have to make sure that every batch we buy the catheter, the sperm should be alive within that catheter for 24 hours. So that kind of a material check should be done before going for intrauterine insemination. So once preparation is done, sperm preparation is done, you should immediately go and do a procedure. And if there is a distance is there, you are getting prepared in one center and going and getting it inseminated, then again it makes lot of difference. So you should make sure you should go to a fertility center and make sure you prepare the sperm, and the sperm is inseminated within few minutes of preparation. I hope this episode was informative. If you have any queries or any doubts, you can write your feedback into the comment box in our Facebook, Twitter or YouTube. You can follow us in Facebook, Twitter, and you can subscribe us for YouTube, so to get more information. Thank you.